Good morning, everyone. I am Bridget Lake, president of the Oviedo Winter Springs Regional Chamber of Commerce, and we are here today at our Elder Care Update. This is an opportunity for hearing how COVID has affected our elder care community and what we can do to help. This is an opportunity for those on this meeting today to speak regarding their business and how they participate, or their business is with, they have an elder care business or participate in that area, and they deal with the elderly community and have an opportunity to share and talk about what is going on and how we can help. So this is a round table, as we would put it, so everybody is able to participate. Now let me go through a couple of our upcoming events. And today, or tomorrow, we have today, forgive me, we have our East Side Regional Hobnob Straw Poll Results Reveal today at 5:30. This is a less than 30-minute program, and we will reveal the winners of our Hobnob that if you were not at the event last week, it was a pretty good event, and you got to learn about Seminole and Orange County candidates. If you want to learn more about them, go to esrhobnob.com and check out our one-on-one interviews and the candidates Q&As to get to know more about them. If you missed the fun live event, you can watch it on the Oviedo Winter Springs Regional Chamber of Commerce Facebook page and see what our candidates chose as their campaign theme song. It was there were some pretty interesting comments on that. We also have Thursday, July 16th at noon, the Virtual Business Alliance with guest speaker, Dr. Walt Griffin, sponsored by the Orlando Business Journal. And we have Wednesday, July 22nd at 10 a.m., the Small Business Big Legal Problems, sponsored by School of Rock. Today's sponsor, we have Beers and Gordon. So thank you, Beers and Gordon, for sponsoring today's Elder Care Update. And now I do want to let you know that if you are interested in keeping track of all of our events, you can either be on our text program, which is Notify OWS Chamber to 313131. You can register for our newsletter, and all of that could be found on oviedowintersprings.org. We also have some great resources on our COVID-19 resource tab on our oviedowintersprings.org website. And if you are a member of our chamber, one thing that we started this year in our strategic plan was doing our OWS RCC discussion board, which is a great way for our members to stay in communication through these trying times and also promote their business, let them know what's going on, ask questions. It's a great way to reach out to the experts that we have in our chamber. Now I would like to thank today's sponsor. We have Beers and Gordon, PA. They are civil trial attorneys. Beers and Gordon has over 65 years of combined litigation experience. The attorneys have represented many different cases throughout the state of Florida, including but not limited to auto cases, auto accidents, slip and fall, and business litigation. If you or someone you know are in need of these services, please visit beersandgordonlaw.com to get your free consultation. Thank you so much, Beers and Gordon, for being our sponsor for today's program. So I would like to start out by going around and seeing, I know that we have a couple people registered that are here today, just going around in the room and seeing who's here that really specifically wants to talk today and talk about how their business deals with the elderly community. And I would like to start with our sponsor, Beers and Gordon. Let's see who we have on the, let me make sure that I could get everyone. I'm going to stop sharing my screen here and see who we have here. Do we have? All right. So is there anyone that, if you wanted to raise your hand or go in the chat box, that would like to talk about what business you're with and what you would like to discuss regarding what your business does with the elder community and what you have gone through and how the community can help? And I know that we have a lot of people on here that deal with the elder community in many different ways. So who would like to begin? Oh, look at that. We have Lisa Gantz. Lisa, would you mind, do you want me to unmute you? Let me unmute you for you. There we go. So Lisa Gantz, why don't you introduce yourself, what business you are with, how you are working with the elder community, and how the community can help.
Hi, hi Bridget and everyone.
I do want to respect everyone's time also, so I would like to keep it in the 2 to 3 minute mark, please.
Oh, sure. This is Lisa Gantz. I'm here with my husband and partner, Charlie Gantz. Together we own Gantz Super Team with Keller Williams Advantage Realty in Oviedo. We have a dual approach to our seniors. I am a senior residential real estate specialist. So my job in that capacity is to help guide seniors as to their options as they grow older, maybe want to not just shelter, not just age in their home, but maybe because the home may no longer work for them, but age in their community. So that would be looking for a downsized house, maybe looking for a condo. There's lots of other options for them, including, of course, adult senior living options. And we do work with area residential facilities, everything from a ALF to anything even more, a skilled facility. So we do work with those folks to help find placement that's appropriate for our seniors, as well as guide them and their families. Now, Charlie is a commercial real estate broker associate. So he has an MBA and he is a retired attorney. So he helps assisted living facilities for those who want to expand their business, or for those who say, you know, this just isn't working for us. We're ready to retire or to go on to something else. And so he links buyers and sellers of assisted living facilities together. So that's us, and community can help, obviously, by giving us a call. We're at, the best number to call is area code 317-709-5122, but we are on the chamber list of real estate agents, and we are happy to serve in any way that we can. That's us.
Thank you, Lisa. And I do appreciate the fact that, because I'm sure there are some senior living facilities on this phone call, on this Zoom meeting right now. And we will be getting around to everyone here. Let's go to Tuscaloosa Nursing and Rehab. Let's unmute you. So next up.
No.
Tuscaloosa Nursing and Rehab. I don't have a name as far as registration for Tuscaloosa Nursing and Rehab. Also can't hear Tuscaloosa Nursing and Rehab. So we are going to move on. Right by your side. Who is with us from right by your side? All right, we're going to keep moving on. So we have Comfort Keepers, Gina. I see you. Let's make sure you unmute yourself. Hold on, I'll unmute you. There we go. Can you, there you go.
Am I unmuted?
You are unmuted, Gina.
Hi, everybody. Anyway, I'm with Comfort Keepers. We are an in-home healthcare agency. We help take care of the elderly folks in their home or wherever their home may be. Right now, things have been a little bit more difficult as far as them being in facilities. We are not allowed to go in the facilities, but some of the caregivers, they have all their equipment, their PPE equipment, and we have, I don't know. I mean, right now I don't know about Tuscaloosa. I haven't been over there to see Rachel, but some of the others are having really, really difficult times staffing, and some of the families are taking their loved ones home because some of the facilities are having issues. So I don't know, that's what I do. The elderly, we try to keep them upbeat and happy, make them laugh. If you can make them laugh, you're doing great. Through all this COVID, they have become more depressed, not being around loved ones, communicating. What we've done, I know that one of our families, just an example, one of our families, we have what's called a grand pad. Others have it. You can take your Apple phone if they have phones and you FaceTime with them. And that has really, I don't know how to make the phone be quiet, sorry. That's really helped out a lot, but most of them definitely need some assistance with that. But if you have any questions, I'm more than happy to try to answer or put you in the right direction, so.
And your biggest mission with Comfort Keepers is just explain your mission with Comfort Keepers.
We try to elevate the human spirits, what we're doing. So by going in and being companions to them, helping them cook, because a lot of your seniors don't eat properly. Piece of cheese and a cracker is not sufficient enough for them. So our caregivers will help them do that. We want them to lead healthy, happy lives. You know, you make it that far, by golly, enjoy the rest of it and just have a good time. I mean, it's tough. What we do is not cheap, but yet it's so rewarding. If you're having a bad day, if you go and talk to a senior, no matter if it's on the phone or where it is, they just uplift me.
Perfect. Well, thank you so much, Gina Brooks with Comfort Keepers. We are going to move on to right by your side. We have Mineka.
That's right. Hi, everyone. Can you hear me?
How are you?
Okay, I'm good. I'm doing good. Thanks for having this Zoom meeting, and I was very interested because we provide non-emergency medical transportation. So we basically work with seniors. We do discharges from hospitals. We do transport doctor's appointments and all other therapies and treatments for our elderly patients. So with the COVID situation, obviously the doctor's appointments have reduced drastically. However, we see that patients are going back to see their doctors, and the discharges are a bit not as much as it was before, because obviously people are avoiding to go to the hospitals, but I feel the hospitals are the safest place because they follow their protocol before anyone can just walk in. And same with the assisted living facilities. We're not allowed to just go in they come out and take the patients from outside. So I feel that both the hospitals and the facilities are taking extreme measures to protect their residents.
Thanks. And have you said you've noticed a decline in people getting transported to hospitals. Do you think that will slowly increase? And do you see any context on here yet? I think that the biggest thing that we need to remember is that everyone here is working with the elderly or it has an interest in getting to know more about helping the elderly community. So gaining connections on this Zoom meeting is really important.
Yes, you're absolutely right. And actually, we provide transport to Tuscaloosa, so that was good to see one of our clients on the Zoom meeting too.
Awesome. Well, thank you so much.
Thank you.
And next, I will move back to Tuscaloosa Nursing and Rehabilitation Center. We are going to go to Rachel. I am going to unmute Rachel from Tuscaloosa Nursing and Rehabilitation Center. Can you hear us, Rachel?
I can. Can you hear? Ooh, there's.
Hold on, let me unmute you one more time and see if we can get that.
Sorry, I'm having technical difficulties apparently today. Anyway, hi everybody. Yes, I am the administrator over at Tuscaloosa Nursing and Rehab, and piggyback off of what Gina and Naz just said. It is quite difficult the times that we're in, especially in skilled nursing. You know, it's getting a little more normalized just because we've, you know, kind of I think gotten the hang of everything, but now with you know, our regulatory agency, ACA, has started requiring that all facilities test their staff every 2 weeks. They just recently extended the emergency rule, so we are still not allowed to have visitors, which has been incredibly difficult due to the fact that obviously we have many residents here and lots of skilled nursing facilities throughout the country that are used to seeing their families and they're unable to do so. So if anybody in the community ever is interested, we've had community providers come and do parades around the building on the outside. We've had people that have sent in cards to the residents and candy and that kind of stuff. So we're trying to do everything that we can to keep them motivated and spirits up. You know, unfortunately with all, and well, maybe the word unfortunately isn't the right word, but with all the tests, everything opening, we are seeing the younger population, you know, the average age and the median age is now dropped to about 35, which, you know, I would say that most of our staff are in that median age. So we test weekly here at our facility. We test all of our residents and all of our staff. So we're a little ahead of the game, but we are finding that there's a lot of people out there that are coming back asymptomatic, you know, positive, that are asymptomatic. You know, one of the things that, you know, has been a big struggle, and I do encourage this if you're not doing this in the community, and you know, I know people struggle with wearing masks and you know, and being inside their homes, but that's really the only way that we're going to beat this right now, unfortunately, and keep our elderly safe. And you know, it's tough every day for these people that are, you know, in skilled nursing. And I have friends that are in other buildings that do have COVID positive patients. And I don't think anybody really understands the struggle that we're going through. Our staff are tired. They're overwhelmed. You know, every day we get new guidance from CDC, from ACA, from everybody else. I just got off a call with admin, you know, and, you know, our hospital systems have been incredible through all this and really working well with each other. And our regulatory agency here in Florida has done a great job too. But you know, the cases yesterday, obviously, or over the weekend, we had over 11,000 cases, and you know, it's scary out there. And when you find out that you have a staff member, or you know, if people who've had patients that go to the hospital or on a vent and those kind of things, it really hits home, you know, and these are young people too, that are getting it. And that's how it gets brought in here if, you know, you're not following the proper precautions. But we've done a great job with safety and keeping our residents, our staff safe. Our company, Southern Healthcare, has done a really great job of making sure that we have PPE available, which has been, I think, one of the biggest struggles for some skilled nursing facilities, and it's looking like it's supposed to get worse by August. You know, if there's one thing that I have to say, please wear a mask when you go outside. It may not protect, you know, it may not do anything for you, but it may do something for the person standing next to you. So we appreciate the community support and everything that the community is doing and everything that you guys are doing as a chamber. And I think this is great that you guys are hosting this this week. So thank you.
Thank you so much, Rachel. And one of the big things that you did note is, you know, the reason that we host these events is A, we want to keep everyone connected, but B, another thing is that we want to make sure that the right people have the right connections also. And a lot of you don't do the same exact thing, but you are in a similar field. So this is a great opportunity that you have that connection of, oh, I heard them on a Zoom. Can you connect me with this specific person? Because I heard that they do this, and this may be a great connection for us to network between each other and work with each other. We all have, you know, a different aspect of this. I mean, you talk about real estate to, I know there's lawyers on here, to there's people who do transportation for elderly, to there's people who help them in their home, to there's people who have facilities for elderly, you know, people. So we all have a different scope in this. Let's all work together and figure out how we can network and utilize each other and work together in this. So there's a really big thing. And right now, I'm actually going to go to Dennis. He's with the Lions Club. And Dennis, let me unmute you here. And we were just talking about, please wear a mask. Dennis, let's talk about masks really quick.
Sure. This is a new service that I want to share, and this is really a networking opportunity. But our Lions group in Central Florida has come up with a new clear face mask that is going to help deaf and hearing impaired people to be able to communicate because they read lips. And so in the chat box, I'm actually going to be putting an email address of our area that if in fact you know anybody who is deaf, or you know someone who is hearing impaired, or they need to be able to read lips to be able to communicate, we're providing these clear face masks and face shields complimentary. All Lions services are free. And over the past month, I've sent out over 300 of these masks, and I'm getting more and more requests. And so please help me network. Please help me share this, because COVID has required that people wear masks now in Orange and Seminole County. And I'll actually go get a mask to show you after I'm done talking here, because very, very proud of what we're doing. I'm also looking for additional seamstresses who are willing to help create these masks. I currently have 4. We will add more, because I know once this hits the real public, the need out there is big, with over 800,000 deaf and hearing impaired in Florida. Thank you, Bridget.
Thank you so much, Dennis. And if you have any a post about that, we'd love to share that without, you know, having to cause you to get so many additional seamstresses. That you're right, it could really explode, and you know, it really is necessary. And thank you so much for sharing. I appreciate that.
Thank you.
I don't have a next person up in line, but I know that there's other people on this Zoom meeting Paul, perfect. So we're going to go to Paul Taylor. I'm going to unmute you, Paul Taylor, talking about providing legal services. So go ahead, Paul.
Basically what I do or can do is work with people that are concerned with their legal documents, especially last will, testaments, the advance directives. I know a lot of people have looked at their advance directives where they had a DNR attached to it related to ventilators. And of course now with the use of a ventilator for a period of time, you can recover. So, you know, things like that you want to make sure are clearly spelled out, especially when you go into a situation where you're going to be separated possibly from those that are in charge of your medical care. So those documents you want to have with you or have available. And then another thing, as we have gone totally virtual, the increase in fraud, theft, including identity and just scams, has just gone exponential off the charts. And I offer a service of monitoring with that. And seniors are out there and just are such easy targets and seem to be the ones that people want to go after first. But anything I can do to help, anybody I can work with, I'm willing to talk to them, and I do free consultations. So, and I recommend other services beyond my own. I try to do as much networking. That's the reason I'm here. I want to be a service as the best we can to the senior population. I know at one time the chamber even had a start of an Alzheimer's group and some things like that way back when. And I know this is a thing that Gina has a special heart for too, and we just want to reach out there and care for those that are at special risk right now. Thank you very much.
Thank you, Paul. And I'm just going to go back to Dennis really quick. If you have the speaker view or at the top right, you have speaker view and gallery view. Dennis, do you want to just talk really quickly so everybody can see you on
Sure, I'd be happy to. As you can see, this mask allows the person to be able to read the lips behind the face mask. And these face masks will protect the person who they're speaking to from actually getting any of the virus or prospects that may be coming forth. But it's also that safety feature. And since we are now required to wear masks, those who need to read lips can get these through the Lions group. We're providing these. And again, I did share the email address for you in the chat box. And yes, Bridget, I will send you the Facebook posting that is on the Oviedo Winter Springs Lions Facebook page. And so we will definitely want to get this out. I have been unsuccessful in getting the Orlando Sentinel to pick up this story so that we can actually broadcast this in a wider basis. For 3 weeks, I've tried and tried and tried. And just yesterday, I wrote the editor trying to get that. But I also have this very cute picture of a 7-year-old who sent me her picture. And I'll put that also on Facebook because it's adorable. This affects all ages.
Yeah, absolutely. We can make it go viral. I love this. Perfect. Thank you so much. So I know that we also have people that we have not heard from in here. And I want to make sure that we're covering everyone. John Nasby, do you have anything to say? Charlene Davis. Stephanie Vollrath. Oh, here we go. John, I just unmuted you.
Yes, this is great. I did mention in the bottom line that there's a senior gathering, a Zoom senior gathering on Fridays at 1. So just if you know anybody who would like to just be a part of that group, just send me their email and we'll get them the information to tie into that Zoom meeting. I do want to ask everybody too, what have you found as far as rapid testing? Any great resources locally where people can get a test and get a rapid result as opposed to waiting 5 to 10 days to find out if they have COVID. So I'm just going to push that out to everybody. I do, as part of what I've done for several years, just a concierge for seniors. So if anybody has a strange request, I love kind of looking into that and trying to find a resource for seniors. So you can just go to seniorneed.com and find out more about that. But anybody has any information about rapid testing locally?
I will do a little plug right there. I have spoken to a few hospital leaders as early as this morning, and it is not easy right now to get testing, especially whether it's rapid testing or not rapid testing. If you look on the Seminole County website, even appointments are gone for the testing sites. People are lining up as early as 4 a.m. to get into the rapid testing sites that open at, 8, just because they only take a limited amount of people. So many people are wanting tests that it is difficult to even get a test right now. So it's unfortunate news, and I wish I could give you better news than that. But it is truly a situation that is, it's a heavy situation. I wish I could give you better news than that.
Mm.
Anyone else want to chime in on that? I really.
Well, I would say this, so I've had some symptoms. So I went, and you can schedule like a care spot. I scheduled the next day, and they're hopeful in 5 to 7 days to have the results. So, in the meantime, you just self-quarantine yourself. And that's the reality, I guess. If you feel that you're sick, you just stay home, quarantine, and get the test, so at least you know if you have it or not. But
Right.
That's not going to really dictate, what you do. You just still got to.
Lisa has something. I'm going to unmute Lisa really quick before we move on to Charlene Davis. Lisa Gantz, chime in on you raised your hand on testing.
Yes, I actually have a medical background, and I recently retired from being a nurse practitioner. One thing people don't really understand about these tests is there is a 30 to 60% false negative. So in other words, just because you have a test that's negative does not mean you don't have coronavirus. Either it could have been a false negative, or you were too early in the symptoms to not have a good viral load for them to detect. So if you are symptomatic and you have a false negative, do exactly what the previous person said, which is to self-isolate and then repeat the test in several days or a week to see another result.
Absolutely. And we are going to move on to Charlene Davis and talking about elder care. Charlene, are you unmuted?
I am unmuted. And good morning, everyone. I am Charlene Davis. I'm the church administrator here at First United Methodist Church of Oviedo, and I also oversee congregational care. I'm very excited to see all of you and to hear your comments. Since I am new to the position of congregational care, I'm going to ask you to spam me. I'm going to put my information in the comments and ask you to send me, your information, brochures, because there's some things that have already come up that I feel like I can pass on to some of our congregation, especially the one about the non-medical transportation. That's a big issue here at our church. And so you know, feel free to reach out to me. You can also, if you know of someone who needs some spiritual healing or some prayers, you know, please reach out to us. We would be glad to, you know, talk to these people or to these families. I think that's all I have to add at this moment, other than I'm really excited to be on this group.
Thank you so much. And let me make sure that we still have some people on this phone call that have not spoken. So if you're interested, please, if you're able to unmute yourself, if you're not, send something in the chat box. Let me know that you're interested in speaking, because I want to make sure that we get around to everyone. I know that we have some lawyers in here also. Lawyers deal with a lot of different issues. I want to make sure that everyone gets a chance to talk. And I know that Legacy Point at UCF just came in. Are you interested in speaking, Amy? All right. If no one else is interested in speaking, then I am going to wrap this up. I do want to let you know that if you are interested in connecting with people on this meeting, please reach out to us. We will share contact information if you want to meet with someone in particular. We are not just going to share everyone's contact information. But if you need any other group information, or if there's some way that we can connect, it looks like Charlene put her information in there. Please feel free to send her information. She wants to make sure that she could cast out some information to her people. And please, thank you to Beers and Gordon for sponsoring this elder care update. Thank you all for participating and making sure that we are not just getting the information to each other, but also making the connections within our community to promote our businesses and support our community and make sure that we are stronger all together. So be safe, stay healthy, and I wish everyone a happy Tuesday, Wednesday, Thursday. Happy day, everyone.